In episode 2 of Basic Hale, we saw how Sally geeked her doctor by asking simple questions. Find out how you can do the same in this episode. The first question that you should ask your doctor is, what is my diagnosis? Before asking this question, you should wait until after your doctor has done their clinical examination and told you the results. Sometimes, what the doctor tells you may not include a diagnosis, and you may not understand what the doctor tells you. This is because some therapists and doctors are not sufficiently skilled to communicate with people by using simple words instead of technical medical jargon. So, if you do not understand whatever the doctor tells you, you should ask your doctor to explain clearly in plain language. You have the right to know. The second question that you should ask your doctor is, how did you make this diagnosis? This question is important because the diagnostic process is very refined today. The process is so refined that if a doctor follows it properly, the probability of mistakes in diagnosis is very small. This is made possible with published guidelines for doctors and therapists on the questions that they should ask and the tests that they should do to help them know exactly what is wrong with you. This is what health experts call evidence-based practice. The trouble is, sometimes a doctor might just follow their gut feeling to give you a diagnosis, which means that their practice is not based on evidence. As the recipient of their service, it is your right to challenge your doctor or therapists to make sure that the care that they provide to you is based on evidence. You can do this by asking simple questions. There are multiple reasons why your doctor's recommendations may not be based on evidence. It may be that they are overworked, that they are seeing too many patients in one day. It may also be that your doctor is more interested in making money than in your well-being. Or the doctor might just be too lazy or too tired to study and keep up with the evidence. By this last reason, you would understand that the fact that a doctor graduated with flying colors from medical school some years ago does not mean that they are a good doctor today. Clinical practice requires constant study to keep up with the evidence. Let us illustrate this with the case of a friend of mine. A friend of mine who likes to cycle a lot developed chest pain. He went to see a heart doctor who did what they call stress testing to assess my friend. In simple terms, stress testing means that the doctor listened to my friend's heart while he was cycling on a stationary bicycle, and the doctor looked at some numbers on the computer to see what was happening in my friend's heart. Then the doctor repeated this test while my friend was resting. To do this, the doctor listened to the heart and looked at some numbers in the computer to see what was happening in the heart while my friend was lying down calmly. After comparing the results of the two tests, the heart doctor told my friend that his heart was fine at rest, but that his heart was beating too fast when stressed. So, the doctor prescribed some medication to slow down the heart. My friend asked the doctor the first question that we presented at the beginning of this episode: what is my diagnosis? The doctor said that he was not sure. The heart doctor said that he thinks that my friend has an inflammation of a part of his heart, or that he is recovering from an inflammation of a part of his heart. But the doctor was not certain of the diagnosis. So the doctor wanted my friend to take medication for a diagnosis that he was not sure about. My friend refused to take the heart doctor's prescription because, with the uncertainty in the doctor's diagnosis, you would think that prescribing medication that will slow down my friend's heart will be something to consider with great caution. First of all, because all medications have side effects. Secondly, because there are other options for my friend. One option is to determine the amount of physical stress that is too much and making sure that he cycles at a slower pace to avoid the level of stress that is too much for his heart. Lastly, there is always the option to do nothing, but to watch and wait and see how the condition will develop. Many health conditions recover spontaneously without treatment. If you wish to see how a patient challenged her doctor's diagnosis, I invite you to watch Basic Hale Episode 2. If you like what you see on Basic Hale, stick up a thumb and share it with your friends. Also, do not forget to subscribe if you wish to see new episodes of Basic Hale as soon as they go live. The third question that you should ask your therapist or doctor is, what are the treatment options? A good therapist or doctor will discuss with you all the treatment options for your condition. They will also tell you the advantages and the disadvantages of each treatment option. Then, they will give you ideas on how you can choose the best option for you. In the end, it is your choice. The doctor should not coax you into choosing a treatment that they think is the best. As you can imagine, explaining all the treatment options in a way that people who have no medical expertise can understand requires refined skill on the part of a therapist or a doctor. Let us illustrate this with the case of 3-year-old Harry, who needs a walking frame to walk because he has cerebral palsy. Harry's father has read a lot about a treatment called selective dorsal rhizotomy on social media. This is a surgery that allows some children who have cerebral palsy to walk independently without a walking frame or any walking assistance. However, this treatment is only appropriate for a very small select category of children who have cerebral palsy. If Harry's father is only focused on what he read on social media, his decision on what to do for his son is likely to be biased. This means that he is likely to decide that selective dorsal rhizotomy is the right thing to do for his son because his narrow focus on this one treatment option does not include information about other treatment options. So to help Harry's father to make the right decision for his son, he needs to ask the doctor the third question: what are the treatment options? The fact is, selective dorsal rhizotomy is not reversible. The effect of the surgery is permanent, so you cannot change your mind after the surgery is done. There are some adverse effects to surgery in general. An important adverse effect in selective dorsal rhizotomy is that it can take away completely something called muscle tone, which a person actually needs to walk properly. Another fact to consider is that because children are still developing physically, most children with Harry's conditions who do not undergo the surgery will eventually be able to walk independently. The difference between those who have the surgery and those who do not have the surgery is that those who do not have the surgery will achieve the ability to walk independently a bit later. You can imagine that this information is very important for Harry's father's decision. Now, this brings us to the last question that you should ask your doctor. What will happen if I do nothing? Doing nothing is always an option. To clarify, doing nothing does not mean that you become a couch potato and twiddle your thumb all day long. Instead, doing nothing means that you live a healthy life without medical intervention. It means that you continue to eat healthy, that you exercise well, and that you understand the things that give you stress and develop ways to cope with them. There are many conditions that recover without medical intervention or any kind of therapy. The following is a very short list. 5 out of every 10 persons who have back pain will recover within 2 weeks without treatment. This means that half of the people who have back pain do not need intervention. As we mentioned earlier, most children who have the surgery called selective dorsal rhizotomy do not have any significant advantage in walking ability over their peers who do not have the surgery, except that they may achieve the ability to walk independently a bit earlier. And lastly, my friend who had chest pain and refused to take the heart doctor's prescription has continued to cycle at cruising pace after getting a second opinion from another doctor. It has been 2 years since he refused the heart doctor's prescription and he is in perfect health. This has been episode 3 of Basic Hale. I hope the information here is useful for you and that you will be back for episode 4.